Have you ever questioned what sparks the sensation of burning in your abdomen? The answer might astound you, as it could be attributed to peptic ulcer disease, a prevalent gastrointestinal condition that afflicts millions globally. This malady is distinguished by ulcers that form on the interior lining of the stomach, upper section of the small intestine or the esophagus. Peptic ulcer disease is more ubiquitous than one might surmise, interfering with the lives of countless individuals worldwide. Its commonplace symptoms, such as abdominal discomfort, a feeling of fullness, and in certain cases, sporadic vomiting, can impact an individual's life quality, transforming rudimentary daily endeavors into daunting tasks. Peptic ulcer disease. Occasional discomfort or pain. It is indeed a severe health predicament demanding attention and appropriate medical intervention. So you may now be inquiring, what precisely triggers this discomfort? Kindly continue watching as we delve more profoundly into the causes of peptic ulcer disease. So what triggers peptic ulcer disease? Well, the two main culprits are a pesky bacterium and certain types of painkillers. Let's start with the bacterium, known as Helicobacter pylori, or H. pylori for short. This little troublemaker has the ability to survive in the harsh acidic environment of your stomach. Over time, it can damage your stomach's protective lining, causing an ulcer to form. The second cause is the long-term use of certain painkillers called non-steroidal anti-inflammatory drugs, or NSAIDs. These include common medications like ibuprofen and aspirin. While they're excellent at easing pain, they can also weaken your stomach lining and increase acid production. Over time, this can lead to the development of ulcers. So in essence, peptic ulcer disease is often the result of a damaged stomach lining, whether it's due to a persistent bacterium or the prolonged use of certain medications. Are there ways to prevent the occurrence of peptic ulcer disease? Stay tuned to find out. Is peptic ulcer disease preventable? The answer is yes. One of the best strategies to prevent this condition is to limit the use of non-steroidal anti-inflammatory drugs, or NSAIDs, when possible. These medications, while effective for pain relief, can irritate the stomach lining and increase your risk of ulcers. Other preventive measures include limiting alcohol consumption and abstaining from smoking, both of which can damage the stomach lining and make you more susceptible to ulcers. A balanced, nutritious diet also plays a key role in maintaining a healthy digestive system and preventing peptic ulcer disease. If preventive measures aren't enough and peptic ulcer disease develops, there are effective treatment options available. These include antibiotics to treat H. pylori infections, acid blockers to reduce stomach acid, and lifestyle changes such as stress management and dietary modifications. Remember, prevention is always better than cure, but if an ulcer does develop, treatment can effectively manage the condition. But what happens if peptic ulcer disease is left untreated? Ignoring peptic ulcer disease can lead to serious health issues. When left untreated, peptic ulcer disease can cause complications that extend far beyond the discomfort of a stomach ache. One such complication is bleeding, which occurs when an ulcer forms on a blood vessel. This can lead to anemia, a condition that leaves you feeling tired and weak, and in severe cases, it can be life-threatening. Another serious complication is perforation, where the ulcer burns a hole through the wall of your stomach or small intestine. This can lead to a severe, painful infection known as peritonitis. Finally, peptic ulcer disease can cause blockage of the stomach, making it difficult for food to pass through the digestive tract. This can lead to weight loss and malnutrition. Early detection and treatment are key in preventing these complications. Regular checkups and listening to your body's signals are essential. Remember, taking care of your health is the first step in preventing peptic ulcer disease.